Oh, that's a sad group. How many of you would actually like to feel better? Everyone should raise their hand. And then usually the question which I already asked, how many of you would respond no matter what I asked? So I thank you for, thank Barbara and thank your whole chapter for allowing me the opportunity to be here today and to present a very unique perspective on reflexology. I've been presenting reflexology since 2003, and I have a unique approach, which we could say reflexology across the board. There's, I don't know how many different styles and types of reflexology, but let me ask you this question. How many of you in this room use reflexology in your practice on a daily basis by show of hands?
I probably do and don't know it.
Yeah, that's
okay,
why. That's why my hands up.
3, 4, 5 of you. Now, of you 5, have you ever heard of the idea that you can take? Is there anyone in here that has low back pain today? That would admit. Okay, two of you. 3. So, have you heard of the idea that you can turn off low back pain in 5 to 20 minutes just by working on the feet? You can turn the complete amount of pain off in their body in 5 to 20 minutes. How many of you actually do that as practitioners? Is my nose growing right now? Do you think that's possible?
Yeah.
By show of hands. Why do you think that's possible?
Because I've seen you do it.
You've seen me do it. So it is possible, but not just low back pain. There's many other things you can help as well. It is estimated that in 3 to 6 hours of time, no matter what you have, which includes 90% of the ailments in the world today, you can help through the science of reflexology. So in 3 to 6 hours of time, and that's not all at one time, but let's say we did an hour a week, in 3 to 6 weeks, you should notice a significant, measurable improvement in your condition. Does that seem unreasonable?
No. It seems pretty.
I've seen that in the last, I've been a therapist in June, it'll be about 12 years. And I've probably worked on well over 14,000 pair of feet in my career. And that might seem like a lot of feet, but it's probably not that many compared to, say, people like Dwight Byers, who's maybe worked on well more than that. What I've seen is, in that amount of time, there's only been a certain number of feet that have not had any tenderness in them at all. So let me ask you a question. Does anyone in this room think that they don't have any tenderness in their feet today? Would there be any? Okay, we have one person right here that doesn't think. There's 2 people. So you 2 don't think you have any tenderness in your feet. Okay. 3. Very brave soul. I'm going to share a little story with you. I was actually a little further north of Europe in Panama. I did the 3 chapters, Panama, Pensacola, and I forget the other one. But anyway, Destin, thank you. So there were a couple therapists at the Panama chapter, and I asked that same question, and they raised their hand. So I'm going to up the deal. I said, well, I'll give you $100 plus a free DVD if you don't. And they had all of the money spent. They had it all spent. They were so excited. And I let them sweat for about 30 minutes as far as waiting. They go, when are you going to work on my feet? So I did. And one lasted about 30 seconds. The other one lasted about 2 seconds. They were so disappointed. So would you like to rethink your position? Now, to give you some odds, out of over 14,000 pair of feet, how many pair of feet do you think I've met? And I'm getting to my point. How many pair of feet do you think I've met that have had no tenderness in well over 14,000?
Maybe 1.
Good guess. A little more than that, but not much more than that. 2 plus 2 is, that's it, 4 people. Now, what does that suggest? If I've only met 4 people in 14,000 pair of feet or more that have had no tenderness, what does that suggest? And by the way, if you had adequate blood supply to every cell in your body and you were in really good health, you probably wouldn't have any tenderness in your feet. So that suggests that most everyone would benefit from reflexology. Now, there are a few different types of strength of reflexology. You have beginner grade strength, you have intermediate, professional, and then the pressure that usually I have to use to get a person out of discomfort in 5 minutes is no mercy grade strength. Now, that's a lot of pressure. And usually what I tell certain clients is that for $50 extra, I'll stop sooner. You remember the clients like that? You're like, okay, I'll pay $100 if you'll stop right now. So I like to have a little fun, because sometimes I was at the Fort Myers chapter about 2 months ago, and there was a therapist. They had about 70 therapists in that chapter meeting. And there was a therapist who agreed to allow me to use the pressure I needed to use to get her out of low back pain. There were 69 witnesses. We got her in the chair, and I used a lot of pressure, and immediately she's like, oh my God, ow, ow, ow. She says, I'm sweating, and she goes, how long have you been? I said, about 30 seconds. And so she agreed to let me do what I needed to do. And in 5 minutes, 3-4 seconds, she had very little discomfort in her back. I said, can I go another 5 minutes? He says, no way. So I said, wait about 10 minutes and your back pain should be gone. I checked in with her in 10 minutes, and she said, my back has never felt better. She said, I think I'm going out dancing tonight. And I said, so would you do this again? And she said, absolutely. So sometimes the immediate emotional response with people is like, you know, you go to a buffet, you eat a lot of food, you're so bloated, you're like, I'll never do that again. But then in about a month's time, you'll go back and do the same thing. Isn't that true? So, how many of you know how many nerve endings are in the feet? Each foot?
7,000?
Yeah, good guess. Roughly, it's estimated about 7,200 nerve endings in each foot. And that's for all of us. Now, those nerve endings have an interconnection with the spinal cord and the brain. So, my point in sharing that thought is, those nerve endings, does everyone eat, drink, and breathe something in this room? Okay, everyone eats, drinks, and breathes, right? Does anyone have any stress? Has a little stress. So everything we eat, everything we drink, everything we breathe, coupled with stress, and then you can couple that with gravity as well, that creates an environment where theoretically little crystalline deposits get embedded in the some 7,200 nerve endings of each foot. And so they corrode the communication from the brain to the extremities and back again. So layer upon layer over your lifetime. Now, how many of you know how many hours in a year? Most of you probably know. You can just whip that right out of the top of your head, right? There's roughly 8,640 hours in a year. And so when you take a person that says, man, it's going to take you 3 to 6 hours to help me with this condition, you know, I don't know if I can afford that. Well, now you have 8,640 hours in a year, and let's say something's been going on 10 years. That equates to about 86,000 hours or more. So you tell a person you're going to help them. I'm trying to reason with you to reason with others on how you can draw them into the value of what we're doing and showing that, yeah, you should be able to afford this because it's reasonable. So if you've had something for 10 years, you've had a chronic pain for 10 years, and I tell you it's going to take you 3 to 6 hours to help something that you've been developing for 86,000 hours, would you buy into that? Most of you would. That's reasonable, isn't it? Well, that's what we generally need, but I am going to take some case studies today and show you how simply you can help people. I don't have to use no mercy pressure today, but it does take a little longer. Here's an equation you may want to write down. Time plus pressure equals result. So the more pressure you use, the quicker the result. And the less pressure you use, let's say we have a mile to go. You can walk it or you can run it. Makes sense? So more pressure, better result, quicker result. Less pressure, it takes longer. But I've seen consistently with anything from lupus, scleroderma, fibromyalgia. These are all case studies that I've worked with personally. Sinusitis, arthritis, which is really a catch-all term. Arth means joint, itis means inflammation. Very seldom do you ever see heat, swelling, or redness in the tissue. So it's probably not a true arthritic condition. But you can take osteoarthritis, rheumatoid arthritis, sciatica, back pain, irritable bowel syndrome, foot pain, knee pain. We had a lady at the Fort Myers chapter who had a bunionectomy, her right big toe. And her toe hurt, her ankle hurt. You know what I did? I held her pinky finger through the application of zone therapy, which Dr. William Fitzgerald was the author of. Well, I held her pinky finger and her thumb for a sum total of 13 minutes. She had had her foot pain for 4 years post-surgery. And in 13 minutes, she had no pain in her toe and no pain in her ankle, just by holding her fingers, the right finger in the right spot. So this is also part of reflexology, reflex zone therapy, they're all synonymous. With the static pressure on the finger, we can hold with greater pressure, better result, less pressure, takes longer, but generally we want to hold anywhere from 2 to 4 minutes, and we will hold on the distal joint space, either medial or lateral, posterior, anterior. And so there's a number of ways to help people, and that woman who was out of pain went out and had an emotional